welcome back to another video on sharks and stims. My name is May and I'm the neurodivergent mom of an autistic almost 4-year-old. Today I want to talk about how you can choose the best pediatric therapist for your child. Those of us with kids with developmental delays and special needs and disabilities are pretty familiar with the different types of pediatric therapy. If you're unsure about the different types of pediatric therapy, there are a few different options. Some of the most popular therapies are things like occupational therapy, speech therapy, and physical therapy. Now, as a disclaimer that I put in pretty much every video, I am not a medical professional. I am not a pediatric therapist myself. I am not a child education or child development professional. I am just a mom of a disabled child who has a lot of different life experiences that I want to share to hopefully help other families that are in similar situations. Finding the right therapist for your child is so important. It is so important. The right person can make all the difference in a therapy. If a child has a therapist that they connect well to, that they trust, that they enjoy being around, there's a much higher chance that they will want to learn from that therapist and that they will actually enjoy the therapy that they're doing. These therapies are such hard work for our kids, even if they just look like playing to us. They're such hard work, and having a therapist that your child can trust and enjoys being around really does make all the difference. On the flip side, having a bad therapist or just a therapist that doesn't mesh well with your child can cause the opposite to happen. Having a therapist that your child doesn't trust and doesn't really enjoy being around isn't going to help them with any of their struggles or their developmental delays or anything, because they're not going to enjoy their therapy and they're not going to want to learn. They're not going to want to go to their different therapy appointments. It can also cause a child to be very dysregulated and upset if they have a therapist that they just don't mesh well with. We actually have a bad therapy experience. When we first moved to our current area, we tried a specific clinic for both speech therapy and occupational therapy. Now, this clinic isn't a bad clinic by any means. I've heard many good things about them from other parents, but it just wasn't the right fit for our son. I don't know if this is the case, but it seemed like these specific therapists didn't have a lot of experience working with autistic children, and because of that, they just didn't really mesh well with my son. They also had a more behavioral-based approach to their therapy, while E tends to respond better to more of a play-based approach. And because E wasn't meshing well with his therapist, we actually had a situation where E went into a meltdown and was dysregulated for an entire day after a therapy session. During the session, he seemed fine. He didn't seem dysregulated. I was there. It seemed perfectly okay. But the second we got into the car after the session, he just let out all of these emotions that his little body had been holding in. He went into a meltdown that lasted hours. And even when the meltdown ended, he was so attached to me that I couldn't do anything but sit on the couch with him. That night at bedtime, it took him hours to go to sleep because he was still so dysregulated from having a therapy session with a therapist that he just did not mesh well with. I couldn't bring myself to take him back to that same clinic. Again, the therapists were perfectly nice people, and I had heard good things about this clinic from other parents, but it just wasn't the right fit for my son. And I feared that continuing to take him back to this clinic with these therapists that he just wasn't connecting with was going to do more harm than good. And again, these therapies are already so stressful for our kids. I didn't want to make the situation even more stressful for him. So we started looking for new therapy clinics for him. And these are the steps that I took to find the right therapists that were the right fit for him. Because of these steps that I took to find the right therapist for my son, we were actually able to find some amazing people for him to work with. One of them is his current occupational therapist, and I think that she is probably the person that he absolutely trusts the most after his father and I. E absolutely loves and adores his OT. She is one of his favorite people in the world, and you can tell just how much that she actually loves and cares about him too. Now, we found his occupational therapist a year ago, and we had actually started with another speech therapy clinic too, but because of scheduling issues, we actually had to switch speech therapy clinics pretty recently. And with that, I used these same steps to find yet another therapy clinic, and I found another clinic that I think will be a very good fit for him, and he's already enjoying and connecting with his new speech therapist. He also recently started physical therapy, and I used these same steps to find the right physical therapist for him, and he seems to really enjoy his physical therapist right now. The very first tip I have for you is to ask others for recommendations. Ask your child's pediatrician if they have any recommendations. Ask other parents in your community if they have any recommendations. If there are parenting groups on Facebook or any special needs parenting groups or anything like that, ask them for recommendations, because they will have first-hand experience with the different clinics and therapists in your area. If you already have a therapist that you trust, you can also ask them for recommendations if you were looking for another therapy clinic. When we started looking for a PT clinic for E, I actually asked his occupational therapist if she had any recommendations of a clinic or a specific therapist that she thought would work well with him. And because she knows E so well, and because she knows the best methods that he responds to, she was able to recommend a specific clinic for us, and they've been great. I ended up going with that clinic for his physical therapy, and we really enjoy working with them so far. Asking for recommendations and first-hand experience from other professionals and other parents is truly the best way to start your search for the right therapist for your child. With this, you can make a list of the different therapy clinics in your area, and you can write down or just make a mental note of what some of the positives that other people have said about them, or even some of the negatives, because therapy clinics aren't perfect, and pediatric therapists aren't perfect either. People will have bad experiences sometimes, and sometimes kids don't mesh well with a therapist, but they're still a perfectly good therapist. After you get some first-hand accounts from other people about recommendations for different therapists in your area, the next step, I think, is to actually look at the clinic's website. A clinic's website can really tell you a lot about the clinic. When I mentioned that therapy clinic that we had a bad experience with, after we had that experience, I actually went on the website to look to see if they had any experience with autistic kids, because it really seemed like they didn't. Sure enough, on their website, they listed a bunch of different things that they help with and that they specialize in, and autism actually wasn't listed on their website. In fact, their website actually lacked a lot of information about the different therapists and about the clinic in general. And again, plenty of parents had good experience with this clinic, but this clinic not having a lot of this information listed on their website and not actually having profiles for each of the therapists was kind of a red flag to me. So when looking for new therapy clinics, something I prioritize is looking at the clinic's website, seeing if they have information about helping kids with specific struggles like my son's, and also seeing if their therapists have different profiles or biographies listed on their website. Now, the website doesn't always reflect how great a therapy clinic is. If it's a newer clinic or a smaller clinic, the website might not be as fleshed out as a more established clinic with a larger base of therapists. But a clinic's website really can give you a lot of insight into their different methods and the philosophies that they follow and who their therapists are and their areas of expertise and the experiences that they've had with specific children with specific needs. In fact, my son's occupational therapist has a biography listed on their clinic's website, and in her biography it actually talks about the experiences that she has working with children with autism, which makes a lot of sense because she does so well with my son, and she's so understanding of the struggles that he has, and she's so knowledgeable about the different things that we struggle with or that he needs help with, and she definitely has a wealth of information about the different things that a lot of autistic kids struggle with. Another tip is to pay attention to the language used on the website and the social media platforms and flyers, and just pay attention to the language that the clinic uses when describing the different therapies that they offer and the different disorders and disabilities and delays that they have experience with. There are some therapy clinics that, specifically when talking about working with kids with autism, they talk about like treating their autism, or because there's currently no cure. Autism isn't something that needs cured or treated. You can treat developmental delays and you can treat the struggles that a child with autism might have, but their autism itself isn't something that needs to be treated. And because of this, if I see a therapy clinic that uses language like that uses language that isn't neurodiversity affirming or isn't inclusive, I know that I need to avoid that therapy clinic because their philosophies are not going to align with what our family believes and what our family prioritizes and what our family thinks is important when it comes to our child, his developmental delays, and his disability. On the flip side, if a clinic uses neurodiversity affirming language, their language is very inclusive, and they make a point to stay away from any kind of ableist language, then I know that there is a good chance that their philosophies will align with ours. Another thing you can do is see if you can tour the clinic. Meet with the therapist before your child's evaluation or anything like that. With this, you can potentially get a look at their different facilities and maybe get a sense of how they work with a child. Depending on how the clinic is set up, you might be able to get a sense of if they use more behavior-based methods or play-based methods. You can kind of see what they prioritize in their sessions. If you're in a clinic with a lot of tables and chairs and not a lot of room for free play, there's a chance that they're more of a behavior-based clinic versus a play-based clinic. Now, that's not always the case, but in my personal experience, play-based clinics and therapists tend to prioritize having large open spaces for children to really have a lot of fun and play. Meeting with the therapist and talking to them personally about their experience and about your child even before their evaluation can really give you some insight onto if this therapist might be the right fit for your child. And one therapist at a clinic might not be the right fit, but another therapist at the same clinic might be the right fit for your child. So always see if you can potentially speak with a couple of the therapists, even if it's just a phone call or a couple of emails, just to kind of get a sense of who the therapists are, their experience, what they prioritize, what is their expertise in, and know that even if you go through with an evaluation at a clinic, you're not stuck at that clinic. Now, insurance can be kind of picky with referrals and... Alright, of course with my luck, my camera died. That's just fantastic. Different insurances have different policies on in-network clinics and out-of-network clinics and things like that, so I can't really give a lot of experience talking about that. But what I can say is that if you have a few different options for different clinics, know that you are not locked into a clinic just because your child goes through an evaluation and has a couple of sessions with them. If you find after the evaluation and a couple of sessions that it's not the right choice for your child, that's fine. Pull them. I did. It's okay. Sometimes even if you think something is the right fit, it's not necessarily the right fit for your family or your child. Man, my arm is getting a little tired holding my phone, but we're going to try and finish this up real quick. Those are my tips for finding and choosing the right pediatric therapist for your child. Finding the right therapist can really make such a difference for kids. So I really highly recommend taking the time to do your research, and again, remember that you're not locked in. That if you need to change clinics or change therapists, that's okay. Thanks for watching, and I'll see you guys in my next video. Bye.